asking for the most appropriate action for the key problem, severe head trauma. The patient took ibuprofen for a headache at 1,500 milligrams, and the rest in their eyes, which they closed at around 1,600, or basically 4 o'clock. So the biggest thing that I'm thinking is that we need to assess this patient's level of consciousness because they just took ibuprofen, which puts them at increased risk for bleeding. And guys, the patient had a headache and they just had trauma. So the worst case scenario is I'm thinking that this patient has increased intracranial pressure. So the solution we're looking for are interventions that the nurse can do to ensure the patient is safe. So option number 1 is incorrect. Technically, the patient can continue to rest after the neuro check, but we have to ensure that the patient is not neurologically impaired first. We don't want the patient to slip into any type of coma here. So option number 2 is correct, guys. Assessment always comes first. So a neuro assessment to check the status and at risk for ICP is priority here. And option number 3 and 4 are incorrect here. So assessing peripheral pulses does nothing really for the neuro status. And option 4, the patient needs to be assessed to ensure that they're just resting and not neurologically impaired, or basically slipping into that coma. So option number 2 would be the most correct option here. So guys, just think, assessment always comes before any type of intervention. We always ensure safety first because the NCLEX follows safety. Okay, that wraps it up. For more details and test tips, please see our ration. Now, using our 3 steps, let's break this down. This question's asking for the best suited statement for the key problem, patient recovering from sepsis that becomes obscene. So, the biggest thing we're thinking, guys, is that behavioral changes and neuro problems. This patient's recovering from sepsis, this bloodborne infection that might have went to the brain. We see it a lot with urosepsis, or basically infection inside the urine with our elderly population. So the solution we're looking for is the response that's best for this scenario. So option number 1 is incorrect here. Just assuming the setting is what's causing the behavior. There's no data to support this, so it's technically incorrect. Now option number 2 is the most correct here. Guys, just think we're assessing the patient. So neurostatus checks for deficits and impairments with the infection, that's the best option for the scenario because assessment usually comes before intervention. Now option 3 and 4 are both incorrect. The patient shouldn't be alone, assuming bad day. So guys, there's no data to support that. And option number 4, calling the family to visit doesn't address the patient's behavior. So technically speaking, option number 2, assessment is the best option. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now using our 3 steps, let's break this down. This question is asking for which task to complete for the key problem, assessing cerebellum function. So guys, just think cerebellum function is C for coordination as well as balance. So we call it cerebellum, cerebellum. So the solutions we're looking for are actions that test patient coordination as well as balance here. So option number 1, Rudinsky's test, doesn't assess coordination or balance here. But option 2 is correct here. Rapid supination and pronation assesses coordination and balance. And option 3, a Romberg test, assesses coordination and balance. So the memory trick we use for Romberg, just think your patient is roaming around. We're testing the patient's gait as well as the balance here. And option number 4 is also correct. Finger to nose assesses coordination. Not technically balance, but definitely coordination. And option number 5, lastly, is incorrect. Shoulder shrugging right here against resistance doesn't really assess balance. Maybe coordination, so that was a good distractor, but we're looking for pretty much balance and coordination. So option 5 is incorrect. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking which patient to report for the key problem further evaluation by the HCP. So anytime you guys hear further evaluation by a healthcare provider, always think ABCs, airway, breathing, circulation, and then a safety. So guys, really the solution we're looking for is who dies first. So option number 1 is the most correct here, because a patient with a head injury has signs and symptoms of an epidural bleed, basically a brain bleed, which can be fatal. Now option 2 is incorrect. These signs and symptoms are pretty much present with Parkinson's disease. And option 3, a patient with seizures has expected manifestations. Now option number 4 was a little bit tricky. So a patient with facial pain has signs and symptoms of trigeminal neuralgia. Basically fancy words for facial numbness. Now, this question could be dental pain as well, so it's technically not a priority over option number 1. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking for which reason for the use of the key problem, thiamine and alcohol use. So, before looking at the options, I'm just thinking here neurological function as well as poor nutrition for alcoholic patients. So, we need something to break down and absorb that alcohol with alcohol abuse. So the solution we're looking for is the purpose of thiamine in this patient. So option number 1 is incorrect. Now it does help with nutrition, but it's not albumin nutrition, guys. So we have to throw that out. Now option 2 and 3 are also incorrect. It doesn't help with alcohol excretion or the blood levels. And option 3, it doesn't help with the lack of desire, or basically withdrawing the desire for alcohol. That's technically anti-abuse because it makes the alcoholics throw up. Now option number 4 is the most correct. Wernicke encephalopathy can occur with low thiamine levels, which affects neurological function. Now, guys, in this question, if you didn't know anything about what the question was talking about, or even what Wernicke encephalopathy was talking about, guys, just think anything that's going to kill the patient the fastest. So if you just remember encephalopathy is a neurological function, then you can say, hey, neuro is the brain, and this might kill the patient the fastest, so it's the most dangerous. So that would make option 4 the most correct. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question is asking for the most appropriate action for the key problem Alzheimer's patients who forgets to eat their snacks. So, This one's a really tricky question here. So I'm already thinking that we feed the patient when they're hungry and we use small frequent meals all day long here. So the solution we're looking for are interventions to appropriately feed this Alzheimer's patient. So option number 1 is correct here. Guys, small frequent feedings can keep the patient full over the long term. Now it gets tricky with the other options, so listen close here. So option number 2 is incorrect because the patient should eat when it's safe. And option number 3, this is the most tricky one. Technically it's incorrect because patients often forget to eat with Alzheimer's. So they'll eat a snack and then forget they ate the snack and then tend to overeat. So just make sure that we keep the patient within normal limits of their caloric intake. And lastly, option number 4 is incorrect because, guys, the patient's family members shouldn't be the ones coaching the patient here. So technically speaking, option number 1 is the most correct. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. Now, this question is asking for the most important to report for the key problem, severe migraines and headaches. So guys, the biggest thing that I'm thinking here before looking at the options are neuro changes and intracranial pressure. Basically, what kills the patient first. So the solutions we're looking for are manifestations that can indicate this intracranial pressure or something that can kill the patient. So option number 1 is technically incorrect. Heart rate and occasional PVCs are technically normal with anyone here. And option number 2 is also incorrect. Nausea and vomiting and headache are expected in migraines. So the data states that patient has a headache and it's not really new. So option 3 is the most correct because that keyword there, new lethargy. So guys, watch out for these NCLEX keywords like new, rapid, or worsening. So weakness may indicate a CVA or a stroke, basically a clot in the brain. So this new lethargy, the worst thing that can happen is the stroke. Now option 4 is incorrect here. Normal urine output is technically not the biggest issue. So option 3 is the most correct. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking for who to assess first for the key problem, caring for patients, basically a list of patients. So when we're given these type of questions, my first thing is to ask ABCs, airway, breathing, circulation. And so the solution we're looking for, guys, is who dies first in these situations. Basically loss of life or even loss of limb. So option number 1 is incorrect here. Retrograde amnesia after a head injury is to be expected. Now option number 2 is the most correct given all 4 options here. So the patient with a seizure diagnosis is having an aura, which means that they're going to have a seizure right now. Technically, out of all the 4 patients, this one is the highest priority since a patient who has a seizure can aspirate their own fluids and you really want to monitor and keep that patient safe. Now option 3 and 4 are both incorrect here. Ptosis with myasthenia gravis is to be expected, and option number 4, stiffness with Parkinson's, is to be expected as well. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking for the most critical assessment for the key problem, Guillain-Barré syndrome. So before you even look at the options, and even if you didn't know what GBS was, then guys, we always go back to ABCs: airway, breathing, and then circulation. Now, Guillain-Barré syndrome is a neuromuscular disorder that makes everything weak. So just think Guillain-Barré, think of a lot of gravity bearing you down. Now, for the solutions, we're looking for findings that indicate the worst potential outcome. So option number 1, decreased blood sugar may be expected, but it's not priority since it's not the worst potential outcome. Now, option number 2, if the patient's unable to raise their head, it may indicate that they're too weak and respiratory failure is impending. So no upper body function. Guys, we have no diaphragm function. A lot of the muscles could be weak. So option number 2 is our most correct here. Now, option 3 and 4 are both incorrect. Guys, excessive urinary output may indicate DI, or diabetes insipidus, where you're diuresing, but guys, it's not the worst potential outcome. And option number 4, an onset of PVCs, those preventricular contractions or premature ventricular contractions, they may be normal. So it needs assessing, but it's not really priority over respiratory. So option 2 is the most correct. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking for the priority action for the key problem, reducing the risk of aspiration. So, breathing contents into the lungs. The biggest thing you have to think is head of the bed elevated or side lying the patient. So, solutions we're looking for are interventions to best reduce the changes or the chances of patient aspiration. So, option number 1 is correct. Side lying the patient best prevents aspiration. Now, this is very true for patients with seizures or really any aspiration risk. You have to lie down. Now, option 2, 3, and 4 are technically incorrect. Listening to breath sounds doesn't prevent anything. Using the incentive spirometer doesn't prevent aspiration. It prevents pneumonia by re-expanding those lungs. And option number 4 is also incorrect. Repositioning every 3 hours, again guys, doesn't prevent aspiration or that choking. Technically, option number 4 prevents any type of bed ulcer. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking for which area of the brain is injured. Regarding the key problem, the patient can't determine sensation with touch. So before looking at the options, you're thinking sensory, which is the somatic part of the brain. So basically, I'm just thinking of the periphery. So the solution we're looking for are areas of the brain that control the sensory function part. So option number 1 is incorrect here. The frontal lobe impacts behavior as well as personality. And option number 2 is incorrect. Occipital lobe impacts vision as well as balance. And option number 3 is correct here. The parietal impacts the sensory function. So the way I remember that is parietal helps with peripheral sensation. A little memory trick. And option number 4, the temporal, is technically for vision and hearing as well as memory. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. So this question is asking for instructions to give for the key problem. You're assessing cranial nerve number 7. So cranial nerve number 7 is for facial nerves and facial expression. The little memory trick you use for cranial nerve number 7 is you make an L like a loser on your forehead and drop it down, and it makes a 7. So just think anything that involves the facial area right here is considered a 7. So option number 1 and 2 are incorrect here. Guys, clenching the teeth and moving the jaws is not technically the facial expression right here on your face. Almost, but not really. Now, option 2, hearing and speaking, is not facial expression. That sounds a little bit like cranial nerve number 8. We turn it sideways, and it's earmuffs. Now, option 3 is the most correct here, guys. Puffing the cheeks, smiling, and here's the key word, wrinkling the forehead, because 7 is right there on the forehead. Now, option 4 is incorrect here. Tongue control is not a facial expression. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question is asking for the priority action of what to do now for the key problem, hemiparesis, slurred speech, and facial drooping here. So guys, this screams CVA. Basically, it screams a stroke. So the biggest thing you have to be thinking with a stroke is we need to get that patient to the CAT scan. We need to give that patient TPA or a clot buster because they have a clot in the brain. But really, first things first is you need to maintain the ABCs. So the solution we're looking for is how do we keep this patient alive, and really how do we prioritize the loss of life as well as the loss of limb. So option number 1 is incorrect here. Now, collecting data and doing assessment is important, and we've been preaching that all along, but here it's not a priority over life-saving measures. So option number 2 is the most correct. Guys, airway trumps everything. It's like you're playing poker, airway is your ace. So keeping the airway patent is priority. Now, option 3 and 4 are both incorrect here. So connecting with the next of kin is important, but not priority, and establishing IV access is important, but it's not priority over the airway. So guys, always think airway is your ace in the deck with ABCs, airway, breathing, circulation. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question is asking for the appropriate nursing action for the key problem, worsening MG, or worsening myasthenia gravis. So just think myasthenia gravis is a muscle gravity issue. So it's an autoimmune disorder where the body's attacking itself, causing neuromuscular dysfunction and causing weakness. So again, the memory trick we use for myasthenia gravis, MG, for muscle gravity, just very weighty and very weak. So, solution we're looking for are interventions the nurse should do for this patient here. So option number 1, guys, this drug is typically taken before breakfast to help the patient swallow during that muscle weakness. The worst thing we want that patient to do is to have difficulty swallowing, and then they aspirate into the lungs. Now we have a respiratory or airway issue. Now, option number 2 is incorrect. Bowel elimination is not a part of the skeletal muscle weakness here. So, we have to put that out. Now, option 3 is correct here. Guys, soft, easy to chew, easy swallowable food is definitely recommended. And option number 4 is incorrect. Atropine for cholinergic crisis is not MG crisis or myasthenia gravis crisis. So just make sure to get your drugs correct. Again, atropine is for a cholinergic crisis where the patient is all dried up. Now, option number 5, lastly, is correct here. We protect against respiratory illness because, guys, myasthenia gravis is muscle gravity or muscle weakness. The patient has difficulty with weakness all over the body, and especially difficulty breathing from that diaphragm, that respiratory tract, that respiratory muscle that helps the lungs breathe. So option 5 would be correct. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking for expected manifestations for the key problem, occipital lobe injury. So, the biggest thing we're thinking about is vision function. So the memory trick that I use for occipital, just think ocular. So it has to do with your vision, your eyeballs. So the solution we're looking for are findings that put the patient that injured that part of the brain, basically vision issues. So option number 1 is the most correct here. Diplopia is a vision issue, basically meaning double vision. Now option 2, 3, and 4 are all incorrect. Dyspnea isn't a vision issue, and incontinence, guys, that just means that you wet yourself or you just can't hold your own body fluids, so it's not a vision issue. And polyuria, you just have frequency or a lot of urine, where you have to urinate a lot. Again, guys, not a urinary or not a vision issue here. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking for findings that need prompt follow-up for the key problem, onset of nausea and thirst. So anytime I hear thirst and prioritization, I always think of diabetes insipidus, or basically DI, where the body is diuresing fluid out of the body into the body. So, big prioritization there. So the key solution we're looking for is abnormal signs and symptoms in the patient. So option number 1 is correct. Largely dilated pupils may indicate a neurocomplication. And option number 2 is also correct. Nuchal rigidity may indicate increased intracranial pressure with meningitis. So you guys remember, inflammation and infection inside the brain, it will lead down to inflammation inside the neck. Nuchal rigidity means it's just very rigid right here. Now, option number 3, a negative Rudinsky's is normal. And option number 4 is also incorrect here. Positive oculocephalic reflex is technically normal as well. So option number 5 is our correct one here. Guys, excessive urine output may indicate ADH issue leading to this diabetes insipidus, where the patient diureses all that fluid out of the body and into the potty. Okay, that wraps it up. For more details and test tips, please see our rationale below. Now, using our 3 steps, let's break this down. This question's asking for the incorrect instruction for the key problem, a seizure disease patient on phenytoin. So before looking at the options, I'm just thinking, take the drug as prescribed and monitor the patient for any seizure activity. So the solutions we're looking for are teaching by the student nurse that are not true. We're looking for the incorrect option here. So options 1, 2, and 3 are all incorrect. So option 1, good oral care is encouraged here. Option 2, the drug may actually reduce the effectiveness of birth control. And option number 3 is incorrect too, because blood tests and blood draws are used to ensure that the drugs are in therapeutic range here. So option number 4 is the most correct here. Medical attention is not needed for all the seizures, only if status epilepticus or if the patient is injured. Now that was really, really tricky, so guys, write that one down. We don't need to report, or we basically don't need medical attention like a hospital for all seizures here. So option 4 is the most correct. Okay, that wraps it up. For more details and test tips, please see our rationale below.
Oh my God.
Now, using our 3 steps, let's break this down. This question's asking for the priority action for the key problem, patient with a stroke who has a blood pressure that is crazy high here. So guys, a blood pressure anything north of 180 is considered hypertensive crisis. So this blood pressure is 232. Guys, we have to automatically think end organ damage, that blood pressure is just punching the organs, leading to a stroke and maybe even a heart attack. So the solution we're looking for is, how do we prevent the worst possible outcome here? So option number 1 is incorrect here. Technically, the systolic blood pressure can't be too low since it won't perfuse the damaged tissues here. Now option 2 is the most correct. We want that blood pressure at 170, which is appropriate. So we want to land the plane, guys, not dropping things too fast, since we still need the blood pressure to perfuse the body organs. Now option 3 and 4 are both incorrect. Normal heart rate doesn't do anything about blood pressure, and normal urinary output over 30 mLs per hour is considered normal. Okay, that wraps it up. For more details and test tips, please see our rationale below.